Today, we're going to totally change how you think about orchid care. You know, we all see repotting as just another gardening task, right? But for an orchid, it's so much more than that. It's not just maintenance, it's basically a high-stakes medical procedure.
I know, it's a pretty dramatic question, but it's one we have to ask. That gorgeous orchid you have sitting there, it might actually be in trouble. Its roots literally being choked, starved of the one thing they need more than anything else, and that's air.
So let's completely reframe this. Forget about gardening for a minute. Think of yourself as a surgeon. For this explainer, we're going to give you the skills, the confidence, everything you need to perform what is, for your orchid, a life-saving operation.
Okay, so before any surgeon can operate, they have to know the patient's anatomy, right? And for an orchid, it all comes down to the roots. And trust me, they are not like the roots of any other houseplant you've got.
And here's the key. Most orchids are what we call epiphytes. Now, what does that mean? It means in their natural habitat, they don't grow in dirt. They actually cling to the sides of trees with their roots just hanging out in the open air. And that one little fact, it changes everything about how we need to take care of them in a pot.
Okay, let's geek out for a second on the root's secret weapon. It's called the velamen. It's this amazing spongy layer that wraps around the real root inside. Honestly, just picture a high-tech sponge. When it's wet, it turns kind of see-through, and you can see the green root inside doing its photosynthesis thing. But when it dries out, it turns this cool silvery white color. That's your built-in signal that it's getting thirsty.
And this is where the emergency starts. That potting mix, the bark chips or moss, it doesn't last forever. Over time, it just breaks down. It turns into this dense, fine mush. And when that happens, all those wonderful little air pockets that the roots need to breathe, they're gone. You're left with a soggy, airless mess, which is a perfect recipe for root rot. That is the suffocation we're talking about.
All right, so how can you tell when it's time to step in? Let's get into the diagnosis part. It's all about learning to read the signals your orchid is sending you.
Think of it like a doctor going over a patient's chart. You're looking for symptoms in a few key areas. We're going to check out how the roots are growing, what the potting mix looks and feels like. And yeah, you're even going to have to give it a sniff.
So let's break this down. See roots crawling out over the edge of the pot? Well, that's pretty obvious. It's run out of room. Take a look at the potting mix. If it looks like old coffee grounds or feels all spongy and gross, those vital air pockets are long gone. And that sour, musty smell, that's a huge red flag. It means things are rotting in there. But the one that really gets people is the leaves. If they're wrinkled and leathery, don't just grab the watering can. It's actually a sign that the roots are dead and can't drink up any water anyway.
Okay, so you've diagnosed the problem. Now comes the really crucial part, timing. You can't just jump in whenever. Performing this surgery at the wrong time in the orchid's growth cycle can actually do way more harm than good.
Every orchid has a sort of annual schedule, Blooming takes a ton of energy. So after those beautiful flowers finally fade, the plant switches gears. It starts focusing on growing new leaves and, this is the important part, new roots. That is your golden opportunity. The perfect time to repot is right when you see those little bright green root tips starting to pop out. That way they grow right into the new pot and the shock is minimal. And here's exactly why that timing is so critical. If you mess with the roots while it's in full bloom, the orchid totally panics. It triggers this thing called bud blast, where it just drops all of its beautiful flowers and buds, sometimes literally overnight. It's a survival move to save energy. So unless the plant is clearly dying, just be patient. Let it finish its flower show first.
Okay, diagnosis is done, the timing is perfect. Let's scrub in, it's time to perform the operation.
Just like in an operating room, we have a clear protocol to follow. First step, prep and sanitize your tools. Then, we gently get the patient out of the old pot. Next, a thorough cleaning and inspection of the roots. Then comes the surgery, cutting away all the dead stuff. And finally, we repot it into a fresh, new home.
Now, listen up, because this is a super important tip that so many people miss. When you get the old pot off, look right at the very center of the roots. You'll probably find this dense little plug of moss or foam. Growers use it to start the seedlings, but in your house, it's a death trap. It stays way too wet and is one of the biggest causes of rot. You have to get it out of there. Okay, roots are all cleaned off. Now for the moment of truth, figuring out what to cut. It's actually pretty easy. Healthy roots feel firm, kind of plump. Dead ones, they'll be hollow and stringy, or just total mush. The color is a dead giveaway too. Healthy is green or silvery white. Dead is brown, black, just shriveled. Don't be shy here. All that dead stuff has got to go.
And here's a pro tip for making the cut. Don't just snip at the dead part. You need to make your cut about an inch into the healthy tissue. I know, it feels wrong, but this makes sure you get all the rot out and gives the plant a clean wound to heal from, which helps prevent any new infections.
So you've made your cuts. Now what? You've probably heard people say to sprinkle on some cinnamon, but is that a miracle cure, or could it actually be a root killer?
Okay, here's the science behind the controversy. Cinnamon is a desiccant, which is just a fancy word meaning it sucks moisture out of things. That's great if you have a cut on a leaf you want to seal, but for roots, it's risky. If you get that powder on the healthy part of the root, that spongy velamen, it can dry it out and kill it. So if you're going to use it, you have to be like a surgeon. Use a Q-tip or something and apply it only to the cut itself, nowhere else.
And the surgery is a success. But we're not done yet. Just like with any patient, the post-op care is absolutely vital. We need to help the orchid recover from the shock of the whole procedure.
Rule number 1 of recovery starts with choosing the right pot. This is so important. You only want to go up 1 or at most 2 inches in diameter from the size of the root ball. Why? Because if the pot is too big, all that extra bark or moss will stay wet for way too long, and you'll end up right back where you started with rotting roots.
Now, there's a huge debate in the orchid world about when to do that first watering after repotting. Some people say do it right away to help the new mix settle. Others say you have to wait a week to let those cuts you made heal up first. You know, a good middle-of-the-road approach? Use bark that's already a little bit damp when you repot. That gives the roots some humidity. Then, just wait about 3 to 5 days before you give it its first real, thorough watering.
So for the next month or so, think of your orchid as being in the recovery room. What does that mean? Simple. First, move it to a spot with a little less light, which reduces stress. Second, try to keep the humidity up. And third, and this is a big one, no fertilizer for at least a month. The salts and fertilizer can really burn those fresh cuts on the roots.
So there you have it. Your patient is stable, it's recovering, and after all that hard work, what's going to be the first sign he gives you to say thank you? What should you be looking for? It's those brand new bright green root tips starting to poke out. When you see those, you know you've done your job. That's the ultimate sign of a successful operation.